Hello, welcome to our Dr. NCLEX. Thank you for joining this channel. I have just one quick question for the next generation to show you that you should not worry about this test. The test is not changing. Only 20% of the test will be this, and the rest will be the same as what you've been taking. In any case, the next generation is just the same question, but in the longer form. It is your first generation question. Convert it into a stand-alone question, and you'll be fine. Let's get to it. Once again, I would like to have you for a Saturday review, free of charge. Okay, this is the case. We have a client in the operating room. That's the scenario. 18-year-old client presents to the emergency room with very low quadrant pain. You see, you have to read it and then pay attention to the keyword. So we have an 18 years old present to the emergency room with very lower quadrant pain. Those are the bad words. Nausea, she had no recent travel, no prior surgery, never had any surgery before, and no antibiotics use, no past medical history, no surgical history, no surgery history. He has no allergy. His temperature is 101, blood pressure saturation of normal. He has pain, some guarding and rebound tenderness at the burning point. So far, what do you see? I have 18 years old, so I'm converting into a standalone question with lower quadrant pain. He has nausea, some vomit, and fever. Never had any surgery at the burning point with rebound tendons. What do you think? I've done it for you here. Appendicitis. Patient has appendicitis. You make the diagnosis. But sometimes they will tell you, you see how you can break it down, you can go through it, and then you find the diagnosis. It's not actually a question. That's why you don't panic. Just read it, be familiar with it, and ask them what kind of question they see, what kind of question they're going to ask you. So let's look at what question we're going to be asked about this problem. Then when you click next, this is where your question, but in a different format you see it. Patient now is in operating room. After general anesthesia was induced, that means the patient was intubated. Patient immediately became tachycardic. His heart rate went up. Rising end-tidal CO2. So end-tidal CO2 also increases. So he has acidosis. His temperature is now 103. He has lockjaw and muscle rigidity. You've seen this multiple times. You read it multiple times. And even if you come to one of my classes on Saturday, I've said this, mentioned these keywords. Common question they will ask you in your test. This is one of the hot guys. There's 4 of them, and you have to know to identify them. These keywords: tachycardia, rising end-tidal CO2, temperature, lockjaw, and muscle rigidity. Then the question is, the patient has what? But the patient has thyroid stone, thyroid surgery. Does patient has neuroleptic malignant syndrome? You get it when you're taking antipsychotic. This is malignant amphetamine. And the management, they give them pain medication to lower their temperature. We give them another outdoor to causes malignant, to causes neuroleptic malignant syndrome, or give them dantrolene. The treatment is dantrolene. Dantrolene will help with the muscle rigidity and muscle rigidity by the malignant amphetamine. This patient is IV fluid. They need to be cooled down. You need to stop the anesthesia immediately. You need to hyperventilate them. All these things are important. But the most important, based on the answer choice we're giving, is dantrolene to stop the muscle rigidity and reverse the effect of the anesthesia inhaling agent. That is what causing it, anesthesia inhaling agent. This patient has never had surgery. They may have a family history of malignant hyperthermia that they may not know. So this is why you ask them before the surgery, have you had surgery? Any member of the surgery, any member of the family had any surgical complication before, after induction of anesthesia. Once again, don't panic. I got your back. We'll do a review, free review for the next generation. You can come and check my YouTube, and we have a bunch of resources for you. It's free of charge, and you'll be golden. Don't panic. It's just a normal test. You can put a lipstick on a pig, but it's still a pig. This new generation thing is still NCLEX. Enjoy and have a good day.